I had the chance yesterday to be a discussant on a very important trial that was run by Dr. Hans-Erik Bodke from Denmark. And this trial in particular, the CONDI-EPIC trial, dealt with the fascinating phenomenon of remote ischemic preconditioning as a method of reducing infarct size and increasing myocardial salvage. And the trial was completely neutral. So the question is really why? The results were very emphatic. I mean, there was simply no benefit to the routine use of this drug in patients with an ST elevation myocardial infarction who were being transported to hospital for primary PCI. And the intervention was carried out in the ambulance. So the question is, why? Is there anything wrong with the theory? Because there's actually been 25 years of experimental models, at least 25 years, to reduce infarct size or increase myocardial salvage. And the data experimentally are very good and really very persuasive. And then in terms of this entity of remote ischemic preconditioning, there's again quite a lot of good preliminary data that would support that it's beneficial. So the question is, why the lack of benefit? And one reason is maybe the difference between the experimental model in an animal and humans. I mean, we're also animals, but we're different from other species of animals. And that's one possibility, that there are just the differences between an experimental model and the clinical situation. I suspect that that's not the main cause. And the other is that although the theory is still sound, the world has moved on. And in the current environment where we transport people rapidly to hospital, open an artery with a stent, the mortality of myocardial infarction is so low that even if you salvage myocardium, it's not going to have any effect on outcomes. And in fact, in this trial, the mortality was about 2%. So although the intervention may make a difference, it's too difficult to demonstrate that difference. And I think that's really the explanation. It's almost, it's a great concept. It was a very good trial, very well done, but the environment has moved on.